hi people, asset mapping. So this is one of the tools that you have been given, and I really want you to exercise and do this exercise, and some of you may have already done this. So all it is a stock take of the people who you are working with, or the people around you or in that community. So that's NGOs, non-government agencies, community groups, government agencies, faith-based groups, yeah, and anyone who is who you think is brings a resource to the table. Now, they don't specifically need to be I guess in the sphere of your work, but it's always good to capture those everyone in that space, in that community. So you may have a long list of them. One thing of doing of drilling down is maybe having them in key themes, because it may help. So things around education, agencies in education and health, or in EC, early childhood, those around supporting people around drugs and alcohol. Yeah, that would all fall into health, I guess. But you can key theme them, and by doing that, you start to identify some gaps. And if there are lack of resources in one area, then at least you can contact or start a little working group by having that stock take list, and start a discussion there. Another good reason to doing this exercise is that you may find there are agencies or groups or people who are working towards the same cause or the same theme, and there may be some sense of some type of duplication in terms of work. So there may be like a huge amount of people working around drugs and alcohol, and that is cool. That's choice. Then maybe it's if it is around duplication and you got all these agencies doing the same thing, maybe it's around calling together a meeting and facilitating that meeting, and finding, okay, that's great that you guys all do the same thing, and it's duplication. However, how else can people access, or how better can they work collaboratively together to maybe start something, or it would probably lead to another outcome where they all collectively put their resources together to promote awareness around drugs and alcohol. So that's just one example of, if you do identify duplication. If you identify gaps, then that's cool. You just need to call people together, and it also identifies who isn't there in the mix in your community, and then contact them and ask the question, why aren't these people here? Is it around their capacity to do so? And I guess through this asset mapping, what you can do, to validate the reason why they should be a part of that conversation, is say, listen, I've done a stock take, and I've noticed that these X amount of agencies doing this work in drugs and alcohol. However, there's a small amount of work dealing with young people around education, and you hold a certain resource. What kind of way can we work together to start bringing in some resources to address some of these issues that the community has identified. So just some thinking around asset mapping. So if you haven't done an asset mapping exercise, do it. It'll be really beneficial for all of you, actually. Do a stock take of who's in there in your community. Name a contact, physical address, telephone, email, all of that stuff. Then write down the resource that they would bring. And maybe also around the kind of coverage of that certain area as well. If they go out towards your area, then maybe you would identify the reasons why their capacity is a little bit stretched. So you can identify these things and be able to negotiate as well. So yeah, that's on asset mapping. And yeah, hope to hear from you if you have done that. It will be really, really choice and good sharing for everyone. All right, bye.